also a lymphocyte, and this is actually neutrophil, but it's not clear. See, here you can see one lobe, two lobe, three lobe, four lobe, and here is lymphocyte. Why? Because this is a single cell, fully covered, and no cytoplasm. This is also no cytoplasm. Here is nucleus. Here is also lymphocyte, but here is neutrophil. So you can see here. So focus. This is the lymphocyte. This is also lymphocyte because this cell is fully. Here you can see nucleus only visible. So this is the one cell. Now let's move to the same cell. Here you can see this is obviously identify the cell nucleus lymphocyte because size, this is RBC, these are RBC actually, and this size is similar to that of RBC and fully covered by nucleus. There is no clear cytoplasm, no granules, nothing. Only nucleus is visible. That is a blue color, dark blue color nucleus. So this is actually neutrophil, but it may not be that clear. Here we can see, okay, so now we can see this is the identify the cell. This is a neutrophil. Why? Because here is lobe, so lobe might not be clear. So suppose this is one lobe, another lobe, so multi-lobed cell, but these lobes are not so clear because overlapping lobes are overlapping here. This is lymphocyte, this is also lymphocyte. So let's move to the next cell. Here again neutrophil, and these other two cells are lymphocyte. Yeah, here we can say this is the neutrophil, this is the lymphocyte. 1, 2, 3 to 4 lobes are there, so that is the neutrophil. Granules are not that visible. So same cell. Here we can see these are the spotting questions. Let me show you one more spotting question. Okay, this is also one spotting question. So what is this? LEISHMAS, this means stain. So using DLC, differential leukocyte count, and all most of the time this is asked as a question. So composition of Leishman stain. So composition is what? 0.15 gram Leishman powder. So this Leishman powder dissolved in 100 ml acetone free methyl alcohol. So acetone free methyl alcohol 100 ml. Okay, so 0.15 gram Leishman powder dissolved in 100 ml acetone free methyl alcohol. So Leishman powder will take 0.15 gram and 100 ml acetone free methyl alcohol, and then mix that and you get the Leishman stain, and that Leishman stain blue color we can use for the DLC, differential leukocyte count. And how we can use? So first we prepare the slide. So blood will take and then make a slide, tongue shape slide, and then after that drying this slide we will put Leishman stain around 8 to 10 drops and wait to 2 to 3 minutes. And after waiting 2 to 3 minutes, what we will do? We will add distilled water, so transparent color, and then after wait for 7 to 10 minutes, and then we can wash it and then focus under the 100x microscope objective, and we will add oil, which was cedarwood oil. So these are the important things you should remember. And here we can see what will this. Okay, so this is again very important topics and type of questions during the crossing. So and sometimes spotting neutrophilia. So neutrophilia means increased neutrophil count. So neutrophilia when? So when you will get neutrophils count increase? So after injection of epinephrine, exercise, pregnancy, menstruation, lactation, any pyogenic infection. So any infection which first is there. Okay, like skin infection, internal infection, sometimes burn, so tonsillitis also you can say, or any type of after surgery. So these are the common things. So few you have to answer. So increase count, I am talking about the neutrophilia means increase count. Increase count after injection of epinephrine, exercise, pregnancy, lactation, infection. So infection, acute infection actually, acute infection usually. And in which condition the count is decreased, neutrophil count is decreased. So neutropenia, neutropenia is decreased neutrophil count. So children visit, sometimes you can see in the children. Then we can also see, mainly we can see three things. One is typhoid fever, viral infection like malaria, kala-jar, and then bone marrow depression. So these are the things that all the, so bone marrow depression is always there in any cell. If count is decreased, then bone marrow depression, bone marrow is not working, so cell production decrease. So eosinophilia, again one cause. Eosinophilia means eosinophil count increase in which condition? So allergic condition, you must remember, like bronchial asthma, then parasitic infestation like worms, hookworm, roundworm, then some skin diseases. Okay? So you will get increased eosinophil count. Then eosinopenia. Eosinopenia means decrease eosinophil count. So ACTH injection and corticosteroid, steroid hormone injection causing symptoms. So these are some common things. Then important is so lymphocytosis. This is also important. Lymphocytosis means lymphocyte count increase. So normal percentage 20 to 40%. So increase in children obviously. Then chronic infection like tuberculosis. So must remember tuberculosis. Then viral infection, sometimes some viral infection you get increased count of lymphocyte. Then lymphocytic leukemia. So leukemia cancerous condition in which lymphocyte number increases. So tuberculosis you must remember. Then viral infection, some viral infection will get higher count. Then now we'll talk about the lymphopenia. Then lymphocyte decrease. So lymphopenia will decrease lymphocyte count. In which condition? Hypoplastic or aplastic bone marrow. Aplastic, HIV/AIDS. So AIDS, must remember AIDS and aplastic or hypoplastic or bone marrow depression you can say. So these are the common conditions with which decrease count. So these are the common questions you must remember. So how will count a DLC? So these are the slide. After preparation slide, how will you prepare slide? You will take a blood drop, then spread in 45-degree angle and make a slide. This is a blood film, and then you will start counting here. Whatever cell you will get, suppose neutrophil you are getting, make a box of 10 into 10, and whatever cell you will get, you focus in 100x microscope. Whatever cell, I have already shown you the cells, different types of neutrophil, lymphocyte, and whatever cell you will get in this focus area, one focus area, you write it neutrophil, eosinophil, neutrophil, and then move to the next focus area. So suppose this is the next focus area. Again you will get said neutrophil, lymphocyte, neutrophil. Then again move to the next focus area. Here you will say lymphocyte, neutrophil, eosinophil, basophil, whatever cell, and then complete it. So up to 100. Total is 100 cell, and then you rank. Then neutrophil count. So count out of 100 how many neutrophils. Suppose neutrophil is 60, so it's 60%. So lymphocyte, suppose lymphocyte is 30, so 30%. Then monocyte 0, so 0%. Eosinophil, suppose 5, then 5%. Like that you have to calculate. So they are the, let's move to the, okay, this is the slide. How will you prepare the slide? So let's see how you can prepare the slide. So take a blood drop, spread angle of 45 degree, keep your spreader and spread like this, and then after drying it, first dry it, ideal blood film, this prepared blood film, and then you have to dry it, and after dry add Leishman stain and full cover Leishman stain, blue color liquid, and then wait for 2 to 3 minutes for fixation. This is not staining but fixation time, and after that add distilled water and wait for 5 to 7 minutes. That is called staining time, or we can say 7 to 10 minutes. So first 2 to 3 minutes after adding Leishman stain, we will wait for fixation, and then we'll add distilled water and wait for 7 to 10 minutes. 7 to 10 minutes, that is called staining time, and after that we'll discard it, wash under the tap water, and we can go put under the microscope and see under the oil immersion 100x after putting cedar wood. So this is the slide preparation. We can do like this. Then what is this cell? Identify this cell. This is the obviously lymphocyte. Why this is lymphocyte? Because these are the RBCs, RBC, and this is also lymphocyte, and this is also lymphocyte, right? See, this is a large lymphocyte and this is a small lymphocyte. Nucleus is almost fully covered. There you can see nucleus is a cell, full cell. Nucleus is covering this much and clear cytoplasm is this much only. That's why this is the small lymphocyte, large lymphocyte. This large and this is a small lymphocyte. So both are lymphocytes. So just have to write lymphocyte. This is the identify. Obviously lymphocyte. This is lymphocyte. This is small and this is large. Same cell. These are the same cell. What is this? Identify the cell. So multi-lobe, how will it identify? This is a neutrophil. Why? Because multi-lobe, 1, 2, 3, 4, around 4 lobes are there. So you can say this is the multi-lobe cell. And fine dusty granules are there, but it may not be visible as clear. When you will see under the microscope, you will get. So it's a neutrophil. So no confusion. This cell again, lymphocyte, and this cell is maybe neutrophil or lymphocyte, because this is not clear. When you will see under the microscope, then only you will get clear idea. So same cell. Let me say this is a lymphocyte. This is identify the cell. This is the neutrophil, obviously 1, 2, 3, 4 lobe. So this is the neutrophil. And granules are not that visible, but fine dusty granules are there. So this is the neutrophil. Next, lymphocyte. Again both lymphocyte. Here you can see this is a neutrophil, this is a lymphocyte. So neutrophil, lymphocyte. Same cell. Neutrophil, lymphocyte, and these are the lymphocyte, neutrophil, lymphocyte. Why this is a neutrophil? Because lobes are overlapping. 1, 2, 3, 4. Overlapping lobes. It is looking like a single nucleus, but it's not single, but it's overlapping. It might not be visible, but here single. Here in the both cells, nucleus or lobes are actually overlapping. That's why it's a neutrophil and not lymphocyte. And this is the lymphocyte, and lymphocyte. Same cell, you can say neutrophil, lymphocyte. Yes, here we can say this is also neutrophil. Why? There is a lobes 1, 2, 3, maybe 4 lobes, and fine dusty granules are there. This is also neutrophil. This is also neutrophil. This is also neutrophil. So see here lobes 1 lobe, 2 lobe, 3 lobe, 4 lobe. Again here lobes are there. These are again lobe 1, 2, 3, 4, 5 maybe. So not that clear, but again these are the neutrophils. Here all the cells neutrophil 4 lobes, 1, 2, 3, 1, 2, 3 lobes, 1, 2, 3, 4 lobes, 1, 2, 3, 4 lobes, 3 lobes, 1, 2, 3 lobes, 1, 2, 3 lobes, neutrophil. Everything is neutrophil. Here only 1, 2, 3 lobes neutrophil. So these all cells are neutrophil. This is also looking like neutrophil. Not that clear. Same cell, again neutrophil, and neutrophil. And this also neutrophil, but not that clear. Here clearly visible lymphocyte, and this is also lymphocyte. So clear. One cell full blue without confusion. This is the same cell.